As we're all aware, around 1 in 8 women in the Western world develop breast cancer. Around 500,000 women this year are going to die from breast cancer around the world. The best way of dealing with breast cancer is via screening, and using X-rays is the best way of screening. Volpara is a digital health company listed on the ASX under the code VHT, focused very much on the early detection of breast cancer by improving the quality of screening. We have around 40 FTEs now, mostly in Wellington, but now a substantial team headed up by Mark in the US, and Mark will talk through that team shortly. The founders were originally from Oxford University, myself and Professor Sir Mike Brady, and the software is now installed in over 35 countries around the world, and we've generated many clinical papers and all the regulatory clearances that we need. Just to remind everyone, we generated revenues around $2.5 million last year by selling a medical device, which was our breast density assessment software, and very much in a capital sales one-off model. During 2016, thanks to the help of Morgans, Phil and Scott in particular, we raised $20 million from various sources in Australia for various reasons. One was to go more direct, and Mark will talk through that. Two was to expand from being almost a pure medical device company into being much more of an IT services company, but also then servicing the whole of breast imaging and not just the desires of the radiologist. And then thirdly, to switch from a capital sales model into software as a service and recurring revenues. So I'm just going to ask Mark to come up now and give you a commercial update on progress.
So, with the raise, what we've done fundamentally is took that opportunity to do a couple of things. And that is, first and foremost, really develop a direct team in the United States. We went out and hired a very experienced team with backgrounds probably on average of 20 years experience in the industry, as well as in women's healthcare, backgrounds including from GE, Hologic, and others. They've made a very quick impact on the market. Additionally, we bolstered our strength in Asia with the hire of Anton Zerl as the VP of Sales and Marketing here in Australia. And we also added David Lee, also a Hologic background in Europe to handle EMEA. So overall, the team is coming together very nicely. It's helped us transition, as Ralph mentioned, from just a density and capital device company into a major IT company overall. And we're making nice strides. So as we all know, the market, just to touch on the market quickly, 8,700 centers in the United States. Over 40 million women are screened every year in the United States, and the spend is about $8 billion in US dollars. That's allowed us to make this shift from just a capital company into a major IT company with the launch of the product last July of Volpara Enterprise. Volpara Enterprise is a constant quality metric tool that we utilize to help manage the overall breast imaging center, and I'll get into that in just a minute. But we appeal to a broader range now. Rather than just a radiologist, we really have expanded our footprint both on the front end with breast imaging managers, the technologists, and the radiologists. If you think about the core density products still at the heart and part of the engine that drives Volpara, you start with a mammogram. This is a good example here of where we were, impactful in a woman's mammogram. On the left, the radiologist called this essentially low density. And that woman would come back the following year for another screening, the annual screening program. Instead, the Volpara software determined it was slightly more dense than that, and we called it a C. So you're higher up on the density scale, and therefore that woman was sent on the ultrasound, and a cancer was found. So I think it's a good example of, where density is still at the heart of our company, what we do every day, but that is shifted now into enterprise. The brand in the company was built through density and clinical validation, our competition, even though there's a couple of competitors on the density side. Fundamentally, we are the market leader. We've got the validation to prove it, the science behind it through Ralph's work and Mike's work and others. But as we now have moved on to an enterprise company, it's allowed this shift to what we consider a SaaS model instead of a capital model. We look at different aspects when we price this. Just to give you a sense, there's a base license fee. There is a feature license fee. Depending upon how many people want to use it, there is a role license for users, and then there's a volume component. So 4 different elements that comprise the overall subscription model for Volpara Enterprise. And we're making nice strides into the market. We have luminary sites up and running, like Boca Raton in Florida. We have 6 subscribers to this at the end of December. Again, having launched in July, so that was just under 5 months of run rate on the subscription model. And you can see we've got a nice range of annual subscriptions from $12,000 US a year to almost $100,000 US a year. We added another nice site, or 3 additional sites in January. So we continue to grow and see an uptick in the market overall. We have, with a couple of large customers, doing very small pilot studies with them, or trials, I should say, in that give them the chance to use the software, get a taste, and then convert those to a full enterprise solution for them. The nice thing about we do not enter a site. The nice thing in the market overall, just to give you a sense, is that there's a huge pull in the market for our software. Any site we go into, they're very interested in our story and understanding what we can do for them to help them better manage the overall quality of the department. Since the launch overall, we can see the value proposition resonating quite strongly. This overall dashboard view of their department from a constant quality metric. We take a look at every single image. We perform metrics around the positioning, the dose, etc., and we really provide that information back to them. And furthermore, they get analytics around all of their equipment. They get information from the referring physicians in terms of what that density profile looks like. And that's where density comes back into play. And but the key drivers of all that are a couple of things. One, the quality assurance focus in the United States overall. 2, the FDA recently released what's called the EQUIP program. And the EQUIP program essentially is a quality assurance program whereby they need to demonstrate that they have that implemented over the course of this year. Next year, they'll be audited and could be fined if they don't have one in place. So that's another market driver for us. It's helping to drive new sales for us, which is a nice compliance piece of the business. A lot of times we talk about the sales cycle. The sales cycle overall, 3 to 9 months. It depends on the center. We deal with big health systems, 20, 30 sites, down to someone who may have 2 or 3 sites. So that really affects overall the sales cycle. Could be as short as 3 months, but we've seen that, as high as 6 to 9 months as well. We're really starting to hit our stride in the market because we're entering that 6, 7, 8 month window right now, and the pipeline is building, and we're starting to see those come over the line, which is fantastic. So the other thing that we're dealing with is IT departments. I think that's a new aspect of this, and we've got a program in place that meets all of the PHI requirements globally through ISO 27001. Just to give you a sense of what that momentum is built. Again, coming out of last year, we virtually had no recurring revenue as a company. And as we look at the books at the end of December, we're at $42,000 a month in monthly recurring revenue, and annually that's almost $500,000 and growing. So total contract revenue, which is something that typically we think of being brought forward to day one under a capital model, we see total contracts that we signed valued at almost $3 million. 6 sites, and we've run almost 250,000 images through our software, enterprise software. So again, nice momentum compared to where we were at this point last year, and we continue to see that growth as we move forward.